So let's start talking about the diseases, and we'll start from the mouth, work all the way down to the rectum. I don't think we'll get all through it done today, but we'll see how much we can get, okay? So the mouth and lips, going to keep it short but sweet. We have colitis over here, colitis, I think you call it, and it's inflammation or cracking of the lips. And, you know, you've seen that when the lips start cracking, whether they're very dry, it could be due to infection, could be because of an allergy, and that's just what that is. It's just the drying of the lips to start cracking. You could also have your gums inflamed. We call that gingivitis, right? Your gingiva is the gums, and if it gets inflamed, that's what happens with that. Sometimes they come, it's not just inflamed, they're actually much thicker and bigger. We have a gingival hyperplasia, or not hyperplasia, it's hypertrophy. And Dilantin, which is an epileptic medication, is notorious for doing that. You see someone who's been on Dilantin for years and years and years, you see their gums really big. That's the reason why. Okay? We also have stomatitis, and this is just any kind of inflammation that's happening in the mouth. Okay? We usually see a lot of this with older people or younger people who have dentures, new dentures. So they put the dentures in, and after a few days, the dentures are like, they got to fit them properly. It's not properly fit in there. So they're riding on certain parts of the mouth, and it's causing some inflammation going on there. So the dentist will take it back and say, oh, I see what's happening over there. They see the areas that are inflamed, so they start shaving down or adjusting the dentures and try that for a couple days and stuff. So we usually see something like that. And then we also have just these aphthous ulcers, which are canker sores, right? You guys know what canker sores are. We don't know the cause of them. We do know that that stress has a risk factor for this. So I would imagine everybody in this class has canker sores. Or you could just call me the canker sore, right? Either way, but we don't know the cause of it. They're very, they go away in about 7 days. So some people like to put medication on it. You put medication on it, it'll go away with or without the medication in 7 days. Okay? So that's really all I want to say about the mouth and lips. There isn't much over there. Okay? Now we're going to go into heavier stuff. So we'll go into the diseases of the esophagus. One of them is this, achalasia. Achalasia is when the lower esophageal sphincter, that's the sphincter that is at the gastroesophageal junction. So it's right where the esophagus meets with the stomach. And there's a sphincter there. That sphincter should open to allow food to go into the stomach, should close to block any food to go from the stomach into the esophagus. Well, sometimes that sphincter is stenosed. Okay? We don't know the reason why for that. A lot of times we're thinking it has something to do with, and keep in mind, we have the autonomic nervous system, the parasympathetic and the sympathetic. The parasympathetic is going to send fibers to the digestion because the parasympathetic does rest and digest. Okay? And it's usually going, the parasympathetics will follow the vagus nerve, remember the cranial nerve number 10, and go down. So there's something, we're thinking that it has something to do with this. It has something to do with the parasympathetics are not innervating the junction as well as it should be. So therefore, it's just going to stay closed, or stay stenotic is what we call it. Okay? So that's what's happening with that. Now, the test we do is usually something called a barium swallow. It's a radiologic test, and barium is something that could actually be picked up by an X-ray. The X-rays don't penetrate it. You can actually see it. But what happens here is that we could actually have the person swallow just bread, and when we take pictures with an X-ray, you just see the movement happening, but you don't see the food, so you can't really see things going on. So what we do is we take some of the bread and we dip it into this liquid of barium, and then we ask them to eat the bread, or we ask them to drink some of this barium liquid. We'll have them drink it, and as it comes down, it's going to coat the lining of the esophagus. So now when we start taking pictures, we can see what's going on. So we do this barium swallow. Here's where the stomach is, and what's classic about this is that they usually have an area that looks like a bird's beak. You see how it's like pointy over here? It looks like this, but upside down. You see it? How it looks like that over here? All right? But yeah, so that's like what's classic that we see that. And what it is that there's a narrowing going on here, and this esophagus is going to bulge out because there's a blockage there. As much as we've been learning about blockages in the heart and how things get dilated, that's what's happening here. Keep in mind, things, when there's a blockage, there's going to be a dilation that's happening proximal to it, right? So you think if there's a motor vehicle accident, you're going to have a lot of cars that are going to go in all the lanes prior to the motor vehicle accident, right? You're going to have more cars there by using the shoulder and the crash lane or whichever. So that's achalasia, okay? Then we have a Mallory-Weiss tear. This is in people who vomit quite often. Good example of this is people with bulimia. People with bulimia feel as though they eat and then they feel guilty and then they want to vomit. So they induce vomiting. It's a psychological problem also. So here's someone that's going to vomit. And retching is vomiting, but nothing's coming out. So your stomach is empty, but you're forcing yourself to vomit and nothing's coming out. So you're retching. You're doing that kind of thing. Nothing's coming out. So it's doing the mechanism of vomiting, but nothing's coming out. So what's happening is that there's so much of this vomiting, all this, remember, you're not just upchucking cookies, you're also upchucking, what's the burning stuff? Yeah, acid. So all that gastric acid is going to burn your esophagus. And when it does, it starts to deteriorate the esophagus, and you can get it so much that it starts getting thinner and thinner until that area starts bleeding. So this is a big cause of what causes GI bleeding in the upper area. Okay. Also with bulimia, when you look at their teeth, people who have bulimia, their teeth are all like rotten. Why? Yeah, all the acid coming up. Okay. The other thing too is you look at their hands. What are you looking on in their hands that they tend to also have? People, what's that? Not tremor. You got it. Yeah, they have these scabs and they have these areas that are all on their knuckles. Why? Because they do all this. And they're banging their knuckles to their teeth all the time. So their hands, their knuckles over here have a lot of sores. So I've been looking at everybody's hands over here, and your teeth are fine. All right? But that's what I mean. You put it all together, okay? Someone who starts vomiting up blood, you notice there's a lot of reasons why they're vomiting up blood. A lot of them. But you also notice that your knuckles have a lot of sores and their teeth are rotten. You're putting a picture here. And you start narrowing what kinds of questions you want to be asking next to her or him. Okay? It's usually a female thing, but we see a lot of males with it too, but more females. So if there's major bleeding, that's what this picture is over here. So the person obviously died because we did a biopsy of this. Not a biopsy, we took a specimen. Here's the stomach over here. Here's the esophagus. And you can see this huge tear that happened over here. It was just massive bleeding that happened.